Imagine this. You wake up with a strong headache, maybe back pain, or stiff joints. You open your medicine cabinet and find a tablet called Naproxen. Many people know this drug as a quick pain reliever. But very few understand how it really works, when to use it, and when it can actually be dangerous. In this video, we'll explore the complete story of Naproxen, its uses, benefits, side effects, and safe dosage tips. By the end, you'll know exactly when this medicine can help you and when you should be extra careful. Naproxen belongs to a family of drugs called NSAIDs, or non-steroidal anti-inflammatory drugs. These medicines are famous for reducing pain, swelling, and fever. Naproxen is sold worldwide under brand names like Aleve, Naprosyn, and Anaprox. What makes it different from other painkillers is that it lasts longer in the body, about 8 to 12 hours. That means fewer doses per day compared to medicines like ibuprofen. But how does it work? Naproxen blocks chemicals called prostaglandins. These are substances your body produces during injury or infection. Prostaglandins cause pain, swelling, and fever. By blocking them, Naproxen helps reduce discomfort and allows you to carry on with daily life. Doctors prescribe Naproxen for many conditions. One of the most common is arthritis. People with osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis often take Naproxen to reduce stiffness and pain. It is also useful in sudden gout attacks, where uric acid crystals cause severe joint pain. Naproxen helps bring down the swelling within hours. Women may also use Naproxen for menstrual cramps. It works by reducing uterine contractions and inflammation, giving longer relief compared to common painkillers. Doctors sometimes recommend it for back pain, tendinitis, bursitis, dental pain, headaches, and sports injuries. Because it lasts longer, athletes often prefer it for controlling inflammation. So the big question, how is Naproxen different from paracetamol or ibuprofen? Paracetamol works well for fever and mild pain, but it does not reduce inflammation. Ibuprofen is similar to Naproxen, but usually lasts only 4 to 6 hours, so you may need to take it more often. Naproxen, on the other hand, provides up to 12 hours of relief and is stronger against inflammation. That's why Naproxen is often chosen for chronic conditions like arthritis, where long-lasting pain control is needed. Now let's talk about the benefits. Naproxen provides strong, long-lasting relief from pain and swelling. It does not cause addiction like opioids. It is affordable, widely available, and comes in tablets, capsules, and liquid suspensions. For millions of patients, it means freedom from constant discomfort. But here's the other side of the story. It's dangerous. The most common problem is stomach irritation. Because Naproxen blocks prostaglandins, it also reduces the stomach's natural protective lining. This can lead to gastritis, ulcers, or even bleeding. Warning signs include stomach pain, nausea, vomiting blood, or black stools. It may also cause dizziness, heartburn, swelling in the legs, or headaches. More serious risks involve the heart, kidneys, and liver. Long-term use can increase the chance of heart attack, stroke, or high blood pressure. It can also worsen kidney function in elderly patients or those with kidney disease. People allergic to aspirin or other NSAIDs should avoid it. Pregnant women, especially in the third trimester, should not use it as it can harm the baby. Nursing mothers should consult their doctor first. So who should avoid Naproxen? People with ulcers or stomach bleeding history. Patients with heart disease, high blood pressure, or stroke history. Those with kidney or liver disease. asthma patients sensitive to aspirin. If you fall into any of these categories, Naproxen may do more harm than good. Now let's talk about safe use. The typical adult dose is 250-500 mg every 12 hours, with a maximum of around 1000 ml per day. Always take it with food or milk to protect your stomach. Never lie down right after taking it. Avoid alcohol and do not combine it with other NSAIDs like ibuprofen or aspirin unless your doctor tells you to. For long-term users, doctors may prescribe stomach-protecting medicines like omeprazole. And remember, use the lowest effective dose for the shortest possible time. Doctors often remind us, Naproxen is not just a simple painkiller, it is a strong medicine. Patients should never self-medicate for chronic pain. Instead, always consult a doctor to find the real cause of your pain. Some patients share helpful advice. They say taking Naproxen with meals reduces discomfort. Others alternate between Naproxen and paracetamol to minimize risks. So what's the takeaway? Naproxen is a double-edged sword. On one side, it gives strong, long-lasting relief from arthritis, gout, menstrual pain, and injuries. On the other, it can cause stomach bleeding, heart problems, and kidney damage if used carelessly. If you ever plan to use Naproxen, treat it with respect. Use it wisely, follow medical advice, and watch for warning signs in your body. Because in the end, medicine is powerful, but only safe when used the right way.